Good afternoon. This is James. I'm giving a report on a 34-year-old male who comes into the clinic with complaints of chest pains, and he's holding on to his mid-sternal area. He says the pain is persistent, and it's started while he's at work. He's a 34-year-old man, healthy otherwise. Before all this happened, uh, he noticed about a day ago he was having a mild chest pain while he was at work. He works as uh, in a warehouse where he moves heavy machinery and heavy equipment. And he said the pain came on as about a 4, but it did not let up, and it became a sharp pain that never let up. It became a 7, and it's been consistent. He's not taking anything for pain. What makes it worse is when he moves, he does something strenuous or even coughing and deep breathing. Sometimes when lifting heavy boxes, he becomes short of breath and the pain becomes even worse. Sitting down makes it a little better. Uh, he has also noticed shortness of breath when he's doing anything that requires strength. Mr. Williams also denies fever, chills, edema, rashes, or headaches, uh, or nausea and vomiting. Uh, the pain has not radiated to any other part of his body. Um, he's not had anything of this before. He says he's afraid it's a heart attack. Um, he does not take any medications for pain. This pain has been troubling him through the night because he wakes up with shortness of breath. Review of systems revealed his alert is already times 4. He appears anxious and tired, appropriately dressed, skin, no lesions, no mild sinuses on the lips, but that's about it. Cardio, no clubbing, capillary refill within less than 3 seconds. Negative for Allen test. Heart rate was 80, regular pulses and 2 plus on bilateral pulses, and also DP and PTs. No murmurs felt on the carotid. The other, no bruise, no S1 and S2 noted on aortic and pulmonic valve area. HENT, patient denies any lymph vein. He denies loss of vision. Sclera is white and clear. Um, no, the sinuses are clear. Cranial nerves 1 to 12 were intact. Respiratory listened, auscultated on all areas, and clear vesicular lung sounds, low pitch throughout, and no adventitious sounds. Abdominal, all 4 quadrants with gurgly noises. Childhood illness, does not remember having anything of this sort before. He does not have any allergies to food or medications. Um, he does not take any medications over the counter. He takes Tylenol for muscle aches. Herbs, he takes cannabis 3 times a week. Does not have any supplements. Hospitalization, he has not had any, not been hospitalized since he's been an adult. Immunizations, he's up to date. He took his influenza vaccine in January 2018. Um, for health maintenance, he keeps up with basketball for exercise. Family history, great grandparents and grandparents are all dead. Mother is living, takes thyroid medications. The father is living, takes blood pressure medication. Sister is living and without any health problems. Social history, patient works in a warehouse loading and unloading trucks. He has smoked cigarettes half pack for 18 years. Beers, he drinks a couple beers each night, and on the weekends he has cannabis. For exercise, he plays basketball, but now he's not been able to because of the chest pain. Background, he's got some education level in college ed classes. He's had no military time, does not affiliate with any religious groups, and has a steady income working in the warehouse. Activities, basketball, no hobbies, no traveling. Uh, Vital signs were stable, all within limits. Alert oriented times 3. Uh, Assessment, um, most likely diagnosis stable angina. Differential diagnosis: acute myocardial infarct, acute pancreatitis, pulmonary embolus, and myocarditis. Cannot afford to miss is aortic dissection. Plan for stable angina pectoris is labs CBC to view hemoglobin, hematocrit in case of anemia, cardiac enzymes, troponin, and troponin. Diagnostic studies: ECG to study his ST elevation, echocardiogram to study his muscle functions, for his cardiac muscle functions, and treatment in clinic: oxygen, 2 liters next to cannula, prescription medications, beta blocker 10 or 50 milligrams daily, and for chest pains, sublingual nitroglycerin 0.6 milligrams every 3 to 5 hours. For education, we asked him to call 911 if no relief with nitroglycerins, to take 1 or 2 pills every 5 minutes to relieve pain, use medications as prescribed. We also told him that they have side effects, which include abdominal cramps, fatigue, depression, lightheadedness, low blood pressure, cold extremities, and sore throat. We also asked him to stop smoking cigarettes and cannabis, follow a diet of low saturated fats, and refer to return to the closest ED emergency room in case the pain is not relieved by nitroglycerin. He needs to establish primary care physician follow-up as soon as possible. If fever continues, if there is any other symptoms, to contact, to go to ED immediately. Thank you.